Hello, welcome to Portage County Matters. I'm Patty Dreier, Portage County Executive. Today we're going to be talking about mental health, and I have two awesome folks from our county staff who will be joining in this conversation about mental health and our life report, local indicators for excellence as they relate to our calls to action, one of which is a call to action on mental health. I want to welcome Amy Markott and Gary Garske. Amy, you are the division head or the manager for our community programs here at Health and Human Services, and Gary, of course, is our public health officer in Health and Human Services, and together you have intertwined roles when they relate around mental health. So I welcome you both to the show.
Thank you.
Thank you, Patty.
Mm-hmm. So let's talk, before we get to the call to action scenario in the show here today, let's talk about what mental health is and how complicated the matter of mental health really is as it relates to our lives and activities in our lives.
Sure. I think mental health is a very broad field, and it's a very complicated one. It has many pieces. Within mental health, you have mental illness, you have wellness, you have treatment, recovery, all different types of concepts. And I think it only speaks to the importance of collaboration and partnership, which is why public health in our community programs division is so important, because our public health programs really are amazing planners and have great skills in that area, whereas our mental health programming and community programs, we kind of take those plans and then we kind of put them into action. Mm-hmm. So I think it's something that really speaks to the importance, the complicated nature of mental health speaks to the importance of the partnerships that we need throughout our community. And
I think, Amy, in your division, you not only relate to adults, but it's kids as well, and mental health issues, AODA, and special programs that bring all of those things together for all ages then.
Correct. Yep, kids actually through elderly. So.
Wow. And then Gary, from the mental health standpoint, what do you see? You know, Amy talks about you having the public health plans, and she's implementing them out of Health and Human Services. And how do you see it?
So again, really from a public health perspective, we always take that population health view. So we realize that a lot of the programs that we work with as well are truly impacted by mental wellness or behavioral health. For example, everything from, like Amy mentioned, AODA, to a work around tobacco cessation, to looking at the impact of drugs and alcohol in our community, to looking at even at the Born Learning Initiative, and realizing that even in our school settings and our other education settings, that the importance of having a well-balanced mental well-being is so critical to learning and to everything that goes beyond that, and through the span of life.
Right, through the span of life. So, Amy, talk about, let's help our listeners or our viewers understand a little more about what do we do out of community programs in Health and Human Services that relates to mental health. What are the kinds of programs and outreaches that we take care of on a daily basis?
Sure. We have our mental health clinic, in which we have psychiatry services, so individuals that need medications. We have their psychiatrist program. We also have therapists. We have in-home therapy for at-risk youth and their families, where we actually go into the consumers' homes and provide treatment in the forms of therapy and behavioral health training for their families and kids. We also have social work programs. One of our biggest programs for kids and adults right now is our comprehensive community services, or we call it CCS, in which it's really a wraparound approach in which that consumer, that child, adult, or their family, they're our boss, basically. And we work with them to set their recovery goals and to be their partner through the recovery journey so we can work them towards independence and achieving their goals. And that program is expanding rapidly and doing a lot of good within our community.
And it's not expanding only in Portage County, but the state of Wisconsin.
Throughout the state.
So that's a great thing.
Absolutely.
Mm-hmm. All right, so I remember when I was a grant writer years ago in county government, I had the opportunity to shadow some of the programs, very specific programs that we offer, some that you mentioned. And I just am thinking about how an individual who has mental illness, for example, may come once, 3 times a week, whatever the scenario is, to receive their medicine at Health and Human Services, thanks to the people on your team that provide that service out of the clinic. And and then that keeps those medications out of other hands. It also ensures that the person has taken the right amount, and we're able to track whether they're receiving appropriate doses and watch for any changes and be ready to connect them with the medical community when they need it. It's really something. It's a huge service.
Absolutely, and it's we've really expanded our programming within our med room to really pair and work with those consumers to not only provide the service that they need so they take their medication safely, but also to make sure that they're gaining skills so that they can work towards more independence and they can really achieve more for themselves, because that makes them feel so good, and every human being deserves that.
Absolutely, absolutely. The other thing that I remember is working on some of the CCS grants. So those wraparound services, when it was first rolling out in that particular time, and now to see how it's continuing to evolve and grow is fabulous. It's fabulous, and I love the wraparound service idea, so that we're recognizing the whole person, and that just because we're in their life on this particular matter doesn't mean that that's the only matter that we can offer resources or connections on, but that there are others around it that we can get engaged as needed. Once you notice that along the way. Fabulous.
Thank you.
It's those multiple touches that really make a difference.
Right. All right, so there may be some people who don't still know as much about mental health as we would like them to know. And then what is how is it different from mental illness? And I want to make sure that we make this distinction very, very clear to everyone. So how about you, Amy? Would you start us off on that one?
Sure. The way that I view mental health is that every single human being has mental health. That's how you take care of your emotional wellness. So how you respond to a stressful situation, how great you feel when you have an achievement, all of those types of things. Mental illness is something that if you have a chemical imbalance in your brain, if you've been exposed to traumatic events over a long period of time, if you have been exposed to stress for a long period of time, and basically you get stuck within your mental wellness or your emotional wellness, and then an illness can develop under those circumstances that then requires treatment.
Or it can be congenital in some kind of a way, right?
Yeah, absolutely. It can be hereditary, it can be genetic, absolutely.
And Gary, what about the stigma when we talk about mental health? This is one thing I remember learning a lot about from people like you, people in law enforcement, people in our mental health community at the hospital, when sometimes people need an in-hospital stay related to mental health. Talk about that stigma aspect.
Well, I would say, over the course of probably the last 5 years, I think it's getting better, and that by that we're actually talking more openly around mental health and mental well-being. But still, it's that mental illness piece that people are like, if I have it, I don't want to share it.
Right.
Or
let people know, right?
Correct. And it's that piece of you're getting a service for a mental illness that somehow you're not right, which is totally wrong. Because again, we want people, because all of us at some point in our life will experience mental illness, whether it's a short bout of depression, or the fact that on a day you wake up and you just feel blue and down. That's a piece of mental illness that's impacting you for that moment. Sometimes we get mental illness that's not truly treatable. Amy, I don't want to speak out of turn, but then there's other times where you talk about with the CCS program, for example, it truly is needed, a needed service to address getting better, or at least keeping yourself in track. So the more we talk about mental health in our community, the goal is to reduce that stigma, so that people will talk about it amongst themselves, realize that it's nothing to be scared about.
Ashamed of.
Or ashamed of, because we all experience it. And then hopefully more people will go out and actually either seek treatment if they need to.
Yeah, my standard is that different is just different. We're the ones that apply the qualitative value. So again, different is just different.
All right, so when we take a look at statistics around mental health, I know that our life report, our local indicators for excellence report, it's a community needs assessment, just came out and had some statistics in it. But let's share a couple of those with the folks listening today.
Sure. I think a few poignant points regarding mental health is that of U.S. adults, there's an estimated 18%, which is actually 43.6 million individuals that suffer from a mental illness. And that means actually 1 in 7 children aged 2 years to 8 years actually has a mental, behavioral, or developmental issue. Furthermore, for Portage County, our home, our suicide completion rates for adults has actually risen from 2010 to 2016.
It's a sad statistic to see in this report.
Absolutely, absolutely. So I think of the many statistics, I think those speak to, that mental illness is it's everywhere. And again, it's nothing to be frightened of, but it's certainly something to be aware of in order to be aware for yourself or aware for your community, and how can you help and how can you support those individuals that need our assistance.
How about this, even just before we talk a little bit more about the issues around mental health and intertwined substance abuse issues and so on that can go hand in hand. How about if somebody's listening and they want to get some help or ask about help for a family member? Could we share that number right now? We'll have it across the screen, and then maybe at the end of the show we could do the same.
Absolutely. If anybody is having any concerns about an acute mental health crisis, have questions about services, there's a number of resources. If you need immediate, like a warm line or somebody to talk to about these issues, you can contact the Portage County Crisis Line, which is 866-317-9362. And that is a line that's open 24/7, 365 days a year, and it's there to support our community and answer questions, as well as to help those that are respond appropriately to certain acute situations. Furthermore, if they're looking for providers, United Way 211 is always an option. It has a list of providers, has a list of resources to get individual service that they need.
When we look at the life report that was just released, what was it, in
November of 2017.
My goodness, it almost seems like it was just last month, but it really was November. So when we pulled this report together and we shared it with the community for the first time, and Gary, you were sharing specifically this first of 4 calls to action related to mental health, I really want to emphasize to the community that there is a note in this report that talks about how we have a lack of some providers serving people in mental health areas. Could we just address that really quickly?
Sure.
And then be able to go back to the life report? Because I just want to make sure that we dispel some myths that are out there.
Sure. When they speak of shortages of providers in Portage County, I think what that really speaks to is psychiatry services. Psychiatry, there's a shortage nationwide, and absolutely a shortage within the state of Wisconsin. The industry term or rule is basically Marathon County North. There's normally not a lot of psychiatrists. They use a lot of telehealth services, et cetera, to get services for their consumers. So we do have a shortage of psychiatry within the community. However, we have many counselors, psychologists, nurses, general practitioners that work with issues of mental health and mental illness that are available to help consumers.
And clinicians like yourself, right?
Absolutely.
Right. So now let's go to this Local Indicators for Excellence Life report. I'm showing a picture of it here, and this is the snapshot, the kind of the abbreviated form, and there's a much more in-depth form of the report that folks can access at the United Way website here in Portage County. Well, anyway, so Gary, what about this whole call to action this time in 2017? And I know that you had something to do with the report years ago as well, and the historical perspective, I think, is a really valuable one for folks to hear about from you.
So again, the Life Report is produced in Portage County every 5 years. So in the 2012 report at the time, we had 5 calls to to action, which did not include mental health. But we realized that after we had identified those calls to action, that the one common theme or thread that impacted each of those 5 calls to action was this mental health element. Because again, it just kind of speaks to the fact that it truly is something that impacts everyone across the lifespan. So again, back in the day, we were looking at, how to close the academic achievement gap. And we talked about AODA and obesity, and we talked about a living wage, and we talked about senior living. And again, all those things really, truly were impacted by this mental health piece. 5 years later, in fact, if you look at the indicators, there were 70 indicators identified for this report. In 2012, mental health simply was just a page. This year, because we just really saw the need to talk more broadly about the spectrum of mental health, that in the new report for 2017 it actually covers 2 pages, because it is so impactful. Again, with the lifespan, and there's so many facets to mental health that need to be talked about.
Just for anybody who is not familiar with the Life Report, it is a community report, a community needs assessment that is done, as Garske says, once every 5 years. We started really only a few years ago. Other communities were doing them sooner.
Correct.
And I knew that it was a great idea and definitely supported it from the start. Anyway, the purpose of the Life Report, I just want to share with everybody as we relate to this mental health topic today, is to identify community strengths, challenges, and priorities that help guide and mobilize action to improve life in Portage County, and also to be an effective tool in raising awareness in our community about quality of life issues, as well as monitor trends and underlying causes. And lastly, serve as a resource, a centralized, easily accessible source of data for nonprofit organizations, policymakers, government entities, faith-based organizations, foundations, corporations, and others. So indeed, this report is a gem, and it was worked on by multiple teams of people. I know that you each had one set of roles, but there were so many others across our community in all sectors that helped through community surveying efforts and so on. We featured all of this on one of the previous shows last fall. Talked about how we pulled all of this together with really literally thousands of views by the time this is assembled. And so now calls to action are identified, identified. And these 4 calls to action include this mental health action point. So what are we going to do? What do you believe are some of the actions that are appropriate for our next steps in ensuring our community's mental health?
Gosh, I think there's lots of options. My opinion is that I think that we have to start with outreach and collaboration. We do things most effectively, much like with public health and community programs, together. And the more that our community stands together and plans together and then acts together, I think that we have the best possibility of, community impact. And so I think that there are multiple possibilities of things that we could do, and I know there's going to be lots of meetings coming up to discuss those options. I'm excited to be a part of them, but I do know that specifically it all starts with that partnership. So,
and it's a partnership not just across the community, but the partnership with each individual or family unit that has those needs, so that there's more internal circles and more external circles.
Correct.
Absolutely.
Gary, what do you see happening from the population perspective?
Again, it's really about collaboration. So again, it's kind of looking at, again, the resources that we have, because at times we are resource rich, but creating greater awareness of the resources we have right here in Portage County. It's, number one is looking at that stigma issue, because again, without breaking the stigma around mental health, we're not going to make much progress, because again, it always seems to be this one barrier that we just can't seem to penetrate or go over. Realizing that mental health really does impact everyone, and looking at the causes of mental health or mental illness. For example, trauma-informed care and adverse childhood experiences. Very important key moments of a person's life that kind of may or may not lead them down a road of mental illness. understanding too the connectivity of how everything is truly interrelated. So whether you're looking at AODA and talking about, why is it that people are addicted to drug and alcohol, or looking at tobacco, why is it that people are addicted to use of tobacco products, or even to the fact of looking at healthy weight and why is it that people overeat or undereat. They're all kind of tied to a mental health element, and so understanding what is it that drives us to do what we do and why we do it truly is one of those breaking points for us.
Absolutely.
When we take a look at mental health in our community, and we look at being responsive as we can be to the moment, it makes me think about our mobile crisis team. Amy, will you talk about that?
Absolutely.
I know that you're one of the leaders on the team.
Yes, I am one of my other duties is also I'm the crisis supervisor for Portage County. So we do have a mobile crisis team that's available from 7:30 a.m. till midnight, 365 days a year, and then from midnight on, then I'm on call basically on the phone to help troubleshoot situations. What our mobile crisis team does is if there's a situation that law enforcement needs assistance as far as assessing the situation as to what should the next steps be, how can we keep this person in the least restrictive environment possible, but still get them the treatment that they need. And they can go on scene, they go to the hospital, they really support our system in trying to protect individuals that need protection, as well as connect them then into the treatment services that are available, be it on an inpatient basis and then on an outpatient basis, to then prevent further crisis for that individual, as well as to help keep the community safe and themselves safe.
So how many people are on the team?
We currently have 9 professionals that make up my community support program, as well as our adult protective services team. So those individuals are on call on a rotating basis at a week at a time throughout the year. And they are highly trained in crisis assessment, in crisis de-escalation, mental health, issues of aging, because that is happening more and more, as well as
Dementia?
Yes, dementia, and for those individuals that need protective service due to issues of dementia. So they are highly skilled, highly trained individuals that are there to really assist those folks in the hour of their greatest need.
Absolutely. Now, Gary, you and your team in public health, as well as linking with those on Amy's community programs team as well, help us in leading coordinating the Walk for Hope every year in
Correct.
September.
Right, and again, that's through the Mental Health Awareness and Suicide Prevention Coalition of Portage County, which truly has an integral part in our addressing mental well-being in Portage County itself.
Talk a little more about that event and then also about that group
Sure.
that organizes it, if you
So
mind.
the coalition has been around for a long period of time. They originally were put together as a committee that supported our Healthy People Portage County initiative, and now serve as a standalone coalition which supports mental well-being and mental health in Portage County. The Walk for Hope itself occurs every second Saturday in September during what is National Suicide Prevention Week. And so again, the walk itself is a 5K walk for anyone. It's not timed, it's not a race, it's just you walk to your best ability. But I will say that most people that come do it as a memorial of sorts for someone they have lost to suicide or were impacted by suicide.
I've done the walk for a number of years, and I'll hope to get there in September to participate again. This, to me, is not because I had some connection with my own family, but because it's just an amazing thing to be part of, raising awareness about suicide prevention. And the ways that you teach us about mental health through various kinds of messages on signs along the way and reflective points, I guess you would say, such as the empty chairs that represent each of the lives that have been lost in the past year and then years before. It just makes you take a step back.
It does.
And really pause and think about the magnitude of the losses and the magnitude of the issue when it comes to a time where someone takes his or her own life and then the family members are left with lots of questions and dealing with things. Hence the reason why we have the mobile support team, the crisis team, to be able to be present for families on the spot. So that call to 911 will mobilize your team.
Actually, what happens is law enforcement will always be the first response. And then when law enforcement is on the situation and they realize, you know, I think I need some more expert help, that's when they contact our crisis line that I talked about earlier, and that's truly our dispatch center. And that then mobilizes that service. And again, we'll go to help law enforcement, et cetera. And we are very tied with law enforcement in our efforts to assist those individuals, so that call to 911 really does eventually get to us if it is a situation like that.
Sure.
And we will always be available for that consult, and again, to get that person where they need to be so they get the services, so then they can truly continue on their recovery journey.
You know, and Amy has put together some really exciting education opportunities, both for law enforcement and for other citizens that work with individuals around mental well-being. You want to talk about those?
Sure. So last year in October, as well as this year coming up in October, I'm a part of a small committee that's bringing crisis intervention partners training to Portage County. And last year we had our training focused on adult mental health. This year we're focusing our training on helping children that are experiencing a mental health crisis, how to best respond, how to de-escalate. And it's a 2-day training that we invite anybody that basically has contact with any human being, really, so that they're prepared and they can then respond appropriately and really get that person to help or help in the moment until help arrives.
Wonderful. We had some special training for law enforcement in our community years ago. I remember we've also got some trauma-informed care kind of programming for those in our justice programs. So
Correct.
we try to hit all the different kinds of pathways, I guess you would say. We're very strong in Portage County in coming together around issues, and I think this is one that we really strive to do our very best, knowing that it's different for everybody, but it's gives us a great deal of pride to be able to offer excellent services. Jefferson House is one example of an excellent opportunity for folks. I do want to put a plug in for that.
Yes.
Amy, could you share?
Absolutely. Jefferson House is obviously a property that's been owned by Portage County for some time, and we've converted it into Rock Point. Rock Point is our mental health drop-in center that is truly a special entity within our entire community. And that is a place where any individual that identifies with having a mental health issue can go for support, such as support groups, a free meal, socialization, job skills training, helping learn how to cook, but where they can just go and be themselves. They're not identified by their disorder. They don't come in and say, I have X, can I come in? They're just, hi, my name is Amy, and I'd like to see what this is all about. And we've seen so much recovery and so much hope be facilitated through that entity that it is exciting to be a part of. It's really neat to see the success stories, because that's why we do this work. And they're helping themselves. They're running this place.
And helping each other.
Absolutely.
That's right. It's a beautiful thing.
It is a beautiful partnership.
I remember when I was approached by Health and Human Services Director Ray Shabilsky, along with our Todd Neufeld Facilities Director, staff member, and together they were looking at what the possibilities were for a facility that the county had that wasn't being as fully utilized as it could be. And so we made Rock Point come alive, and it's been an absolute joy to drop in, as I have, to see folks there, and to be present to support that hope that is happening on Jefferson Street for sure.
Absolutely.
Well, listen, I know that we're going to draw the show to a close. So Gary Garske, Public Health Officer, Amy Markott, Division Head of Community Programs at Health and Human Services, both of you are such an important part of offering mental health services to people in our community, and I thank you so much for joining us here today.
Thank you, Patty.
Thank you.
We'll see you next time on Portage County Matters.